Hello, my name is Caitlin, and I'm a pediatric pharmacist here at Orlando Health Arnold Palmer Hospital for Children. I'm going to talk to you today about two medications that are commonly used to treat pain or fever. These medications are acetaminophen or brand name Tylenol and ibuprofen or brand name Motrin. These medications can be purchased over the counter or they may be filled as a prescription from your child's pediatrician. Ibuprofen is in a class of medications called non-steroidal anti-inflammatory medications, or NSAIDs for short. It works by blocking signals in the body that cause pain, inflammation, and fever. Acetaminophen works in a similar way to treat pain and lower fever. When your child takes these medications at home, you should give them the medication exactly as prescribed by your doctor or as directed on your discharge instructions. These medications can also be found in over-the-counter combination products, which can increase the risk of overdose. So make sure to only give your child the prescribed acetaminophen or ibuprofen from one source. If your child is taking ibuprofen, make sure they're not taking other medications in the same class of non-steroidal anti-inflammatory medications, or NSAIDs. Other over-the-counter NSAIDs will be labeled as such on the bottle, but ask your pharmacist if you have any specific questions about this. Acetaminophen and ibuprofen are available as liquid solutions, tablets, or as chewable tablets. If your child is taking the tablet form, they should swallow the tablet whole with a full glass of water, with or without food. If your child is taking the chewable tablet, have your child chew well before swallowing. If your child is taking the liquid, make sure to shake well before use and pull up the prescribed dose of the medication using an oral syringe. Remember to measure the dose by lining up the top of the outer edge of the black line of the plunger with the desired dose or number on the syringe. The straight edge of the plunger is used to measure the medicine. Do not use the dome to measure that dose. Don't use a household teaspoon or tablespoon, as these are not accurate measuring devices for medication administration. It's important to note that the liquid formulations of these medications are available in different concentrations. So pay close attention to the concentration and make sure to talk to your nurse, doctor, or pharmacist if you have any questions about the appropriate volume to give your child. Acetaminophen is also available via a rectal suppository. If giving your child the suppository, be sure to wash your hands before and after use. Remove that foil wrapper and wet the suppository before putting in the rectum. Using your finger, insert the suppository into the rectum with gentle pressure using the pointed end first. Hold the suppository in place for a few moments and have your child remain lying down for 5 minutes to prevent the suppository from coming out. Ibuprofen and acetaminophen are commonly given on an as-needed basis for pain or for fever. However, if your child's doctor prescribes this medication to be scheduled around the clock and your child misses a dose, give the dose as soon as you remember. If it's almost time for your child to take the next dose, then skip the missed dose and do not give 2 doses at one time. The most common side effects that your child may experience from these medications include upset stomach or throwing up, trouble sleeping, headache, constipation, or diarrhea. Ibuprofen is more likely to cause stomach upset or heartburn, and if this happens, taking the medication with food may help. If your child experiences severe side effects or signs of stomach bleed, such as black, tarry, or bloody stools, mucus in the stools, throwing up blood or throw up that looks like coffee grounds, or severe stomach pain, it's important to seek medical attention right away. Other rare but serious side effects include signs of an allergic reaction, such as rash, hives, itching, swelling, or trouble breathing, or severe skin reactions such as red, swollen, or peeling skin. Although rare, too much acetaminophen can cause liver problems, and too much ibuprofen can cause kidney problems, and the signs and symptoms will be listed on the screen. If you think your child is experiencing any of these severe side effects, call your child's doctor right away. When you get home, keep the medication in a cool, dry place at room temperature, away from heat or moisture, and away from small children. Listen closely to the instructions described by your doctor, and please let your nurse, doctor, or local pharmacist know if you have any questions about this medication. Thank you all for watching, and goodbye.